now.
Monitors and pacemakers have been shrinking in size since their debut decades ago, but now some newly approved devices are taking a drastic leap and getting even smaller. For patients who've experienced dizziness and heart palpitations in relation to abnormal heart rhythms, this is absolutely amazing news. So joining us today is professional race car driver Chuck Beal, who was one of the first patients in the country to actually receive this, and Dr. John Rogers, who can fill us in on more details. Good morning, gentlemen.
Good morning.
Good morning, Lisa. Thank you.
Thank you so much for being with us this morning. So this is, like I said, very good news for folks who are looking for other options with heart monitors and pacemakers.
That's right, Lisa. Sometimes patients' symptoms, like Chuck experienced, don't happen very often, but when they do recur, they're often debilitating. And oftentimes, most of the shorter-term 24-hour monitors or 30-day monitors that we use to try to catch these heart rhythm problems are not successful because the symptoms may be more infrequent than that. So this type of under-the-skin heart monitor allows us to monitor our patients long-term, up to 3 years, continuously, and then receive that information wirelessly on a daily basis from our patients' homes.
So Chuck, can you talk about what it's like to have this device and the moment that you had this discussion with your doctors and made the decision to get this?
Well, I've had this problem for about 2 years, and it's random. It's very sporadic, and you can't track it unless you have a device like we implanted in February of this year to 24/7 track your heart activity. They tracked my heart for about 2 months. They were able to figure out exactly what's wrong with my heart and went in and did a catheterization or an ablation procedure and fixed my problem. So that's the beauty of this little device.
So this is just, is this a temporary thing, doctor, to just monitor and then for the doctors to figure out what needs to be done next?
Well, Lisa, the battery lasts about 3 years on this device, and how long it stays in is very individual on a patient-by-patient basis. So some patients, like Chuck, we found an arrhythmia. We treated it with, in Chuck's case, the ablation therapy, and then talked with Chuck about leaving the device in to continue to monitor his heart to make sure that we treated it as effectively as we hoped we did and to see if he has any further heart rhythm problems. Other patients that might have lightheaded, dizzy, or passing out spells might actually have too slow of a heart rate, and those patients might need a pacemaker. Oftentimes when we put in a pacemaker, we would take this monitor out since we can now monitor a patient's heart rhythms through their pacemaker. So it's very individual, and that decision is made with the physician and the patient on a very individual basis.
So is this more about convenience, or is this a life-saving technology?
I think this is much more about a life-saving technology than it is about a convenience. Most of the heart rhythm problems that patients have are sporadic, and we just can't catch them. They may be at risk of sudden death or stroke if we don't catch it. So it's more life-saving than it is just a convenience. So
important. Thank you both for being with us this morning and letting us know about this fantastic technology. For more details, just check out monitoryourheart.com, and we'll also have this on our webpage. And there is more broadcast when we come back.